first. And then we go to our presentation. And so, where is it? Okay, here it is. And as you see, today we are going to deal with medication. So this is Unit 5, dealing with medication of the book that we study. And so you remember that about, I remember about the task that you've done, the task about the description of tests and procedures, the presentation that you prepared. We'll listen to your presentations later during the third hour today, just because we need to go on with our studies, and then the third hour will be about your presentations. And today we start with the following. As you see here, there are names of different drugs, and there are different types of drugs given here to the right. And our task here is first just to read them correctly with the correct stress, and then just distribute the drugs, decide which type that each drug belong to. So the drugs here are paracetamol, cyclizine, salbutamol, aspirin, enoxaparin, then ranitidine, chlorpheniramine, and diazepam. So here are the names of the drugs. They are not very easy for me to pronounce, and we should decide which type of drug they belong to. So the types of drugs are antibiotic, then analgesic, then there is antiemetic, then sedative or hypnotic, gastrointestinal, then antihistamine, cardiovascular, and respiratory, right? So can we just identify antibiotics here on this list of drugs? Aspirin.
Yes, amoxicillin.
Amoxicillin, ma'am.
Amoxicillin is antibiotic.
Amoxicillin is antibiotic. What about analgesics?
Aspirin.
Paracetamol.
Aspirin.
Ma'am, even paracetamol.
Paracetamol.
Yes,
Okay.
Yes.
Then
cyclizine is antihistamine.
And
yes,
cyclizine is also antiemetic, ma'am.
Yes, ma'am.
antiemetic,
It's
yes.
also antihistamine.
It means preventing vomiting, yes.
Yes.
So what about sedative?
Diazepam is a
Diazepam.
Exactly, yes, you're right. This diazepam is sedative or hypnotic. Then gastrointestinal.
Ranitidine is a
Ranitidine.
Ranitidine.
You're right, okay.
Amoxicillin is
Then
antihistamine.
antihistamine, which one?
Amoxicillin. No, ma'am.
Cyclizine can also be
Cyclizine, yes. And this difficult for me.
cardiovascular.
Chlorophenamine.
Chlorophenamine.
Phenamine.
Phenamine.
Yes,
Chlorphenamine.
you're right. Okay.
Yes.
Then cardiovascular. Which one? Cardiovascular. So this is very popular, just drug.
Aspirin.
Aspirin. Yes.
Aspirin.
Aspirin.
Vasodilator.
Cardiovascular and respiratory.
And respiratory, ma'am, it is
It's
Salbutamol.
Salbutamol,
Salbutamol.
Salbutamol, you're right.
Salbutamol, ma'am.
Okay, so how do you remember all these names? So it's hard for me. And so here there is a question. What are the benefits of each drug? So if we speak about benefits of each drug, as I mean, for example, you say that amoxicillin is antibiotic. Why do people just take this drug?
Ma'am, kill the
Get rid of
bacteria.
bacterial on other infections.
Antibacterial and is
In
more
pneumonia also.
effective.
Pneumonia.
All the bacterial infections, ma'am.
Okay.
Yes, ma'am. Any bacterial infection to provide the
It helps
And it
antibiotics.
is a broad range of bacteria.
And ma'am, for the analgesic, ma'am,
Antibiotic. It is a broad range of antibiotic.
decrease the temperature.
It is
You are
also
speaking,
help in relieving the pain, ma'am.
you are speaking
And
about
decreasing
analgesic,
the pain, ma'am.
analgesic, yes?
Yes, ma'am.
As
Yes,
aspirin
ma'am.
and paracetamol. Okay. Okay. And what about antiemetic, which is cyclizine?
Antimat.
Ma'am, vomiting or nausea, it can
It prevents those.
Nausea, ma'am.
it
Other
prevents
side
vomiting and
Yeah,
nausea,
ma'am.
ma'am.
I
Nausea.
see.
Yes, ma'am.
Mhm.
The
And
feeling of nausea.
yes, what about sedative or hypnotic?
It gives sleep inducing.
Some dizziness.
It
and
is like
drowsiness.
inducing the
And
sleep, ma'am.
releases stress
But why?
and
Why is
depression,
it used?
anxiety also.
Why?
To induce the sleep, ma'am.
And
Sleeping pills,
depression,
ma'am.
Or
Sleeping pills. Mhm.
reduces the anxiety and anxiety
Uh-huh.
disorder.
Yes.
Ma'am, it
Psychological
ma'am.
disorders.
Mhm,
It
mhm.
actually helps a person to lose the control over his
Relax.
conscious mind so that
Yes.
he or she can carry on with the procedure without the feeling of pain.
Exactly. Mhm. Great. Okay. Then if we move to gastrointestinal,
Ma'am, it helps
When
heartburn,
it helps in
stomach ache,
relieving
and
such
ulcer.
Digestion and all, ma'am.
mhm,
To
Yes,
cure
ma'am.
indigestion and all, ma'am.
okay.
Stomach.
And to absorb nutrients effectively.
Mhm, mhm.
yes,
So
Even during the
antihistamine,
hydration.
antihistamine.
Ma'am,
Allergic.
to reduce allergies and all, ma'am. Allergic conditions.
Mhm.
Allergic symptoms.
allergic.
To relieve allergic symptoms.
Exactly. Okay. So cardiovascular. What about this?
Ma'am, vasodilator.
Ma'am,
Like
like
we know, aspirin
to
is
increase and decrease
vasodilator.
the blood pressure of the
Yes,
blood.
ma'am.
To
Decrease.
increase the blood pressure. Retinol
and also
to increase the blood
Uh-huh.
pressure, ma'am.
relaxes the blood
Retinol used in
vessels.
the
And
yes,
Most
ma'am.
essentially,
Increase in blood
increase the blood
pressure.
pressure.
Blood pressure,
Yes.
ma'am.
I see. Okay. Mhm, mhm.
Yes,
it
ma'am.
affects the function of hearts and blood vessels.
Yes. Mhm. And respiratory. So which
Ma'am,
is
it
To
reduces
relieve or
uh,
treat respiratory diseases such as asthma and all,
asthma.
Yes,
and
ma'am.
chronic
Ma'am,
bronchitis,
diseases.
reduces swelling of
okay.
airways.
or
ma'am.
any other pulmonary diseases, ma'am.
Yes.
Ma'am,
Yes,
actually,
ma'am.
it dilates the airways.
Also pneumonia.
So it is based. Subutenol is basically used in bronchitis, and when it is taken with aspirin, then it is used in asthma.
I see. I see. Great. Well, so very informative for me. Now, if we move to the next slide, so we can see a logo of just organization. What is it? Central Drugs Standard Control Organization, Ministry of Health, Government of India.
Yes. Yes,
So
ma'am.
what is the function of this organization, of this agency? So it controls.
Ma'am, basically, they are responsible for approving any drugs, ma'am, or
Yes.
conducting
Yes, ma'am.
And
different clinical
medical
trials,
device.
ma'am,
Mhm.
Yes,
and
ma'am.
to check the standards of the drugs, ma'am.
Exactly. Okay. And
Drug
so,
trials and approvals,
Even
ma'am,
ma'am,
basically.
Mhm.
even ma'am, in
Yes, advices.
Yes.
also CDMO is also responsible for checking how much drug is given to a certain hospital so that no one
Mhm.
can actually send the drug in black.
I see. Okay.
And then
Yes.
banning of drugs and cosmetics, grant the test license.
Mhm. Okay, so
Mainly regulating.
similar type of agency organization exists in every country. So if we move here to the next slide, we can see that the regulatory agencies that approve the use of drugs in the USA, it's called Food and Drug Administration, FDA. So in the United Kingdom, the name of such agency is National Institute for Clinical
Clinical
Excellence. So nice, we can say. And in Kazakhstan, the name of such agency is National Center for Expertise of Medicines and Medical Devices, NDDA, in our country, in Kazakhstan. So, and we understand what these agencies deal with. Now, I would like you also to remember to pay attention to such realia as generics. If we speak about medicine, this is very popular about medication. So you know that generic drug is a medication created to be the same as an already marketed brand name drug in dosage form, safety, strength, route of administration, quality, performance characteristics, and intended use. So the same, yes. And but there is a difference between a marketed brand name drug and its generic. And what are the arguments for and against making generic versions of new medicines available in every country? So why is it good or maybe bad? Okay, let us just listen to Arun Chalam. Are you here?
Yes, ma'am.
So what can you say about this?
Actually, these generic medicines, they are they are not against, ma'am. They are actually helping the country, ma'am. The generic medicines also, the prescriptions are it is available in all over the pharmacies present in India, ma'am.
Mm.
And they are sold in many ways, ma'am, like international property way, typically at a lower cost also, ma'am. It is actually created for the well-being of all the people, ma'am. Also the various status of the people, ma'am.
Okay, okay. You are just speaking in favor of generics, yes, in favor of using them. Okay, so who can add anything to this in favor of using generics?
Ma'am, can I?
Ma'am, can I?
So your name, please?
Priya.
Priya, please. Mhm.
Yes, ma'am. Ma'am, the most significant advantage of using the generic drugs is the cost, ma'am. First of all, which can be up to 85% less than the brand name, and the lower cost generic drugs have been shown to increase the likelihood that the patient can get the easily every patient can get the easily
But
medications
why is
as per.
But why, I'm sorry to interrupt, why is the price lower than for brand name drug? Why is it
Ma'am,
lower?
because poor peoples can also offer them.
I see.
Ma'am,
But-
ma'am, I'm
Okay.
Namita. Actually, the reason of these generic drugs to be have a lower cost price is their manufacturing. If we take country like Cipla or Himalaya, if we take companies like Cipla or Himalaya, they have actually like huge. They put huge amount in manufacturing and packaging the medicines. But what happens with generic medicines? They are produced at the local in the outskirts of my
Mhm.
own city, we have
Okay.
a factory over there. That's
Mhm.
why their cost reduced by 20 to
Yes.
50%.
So the companies that produce generic drug, they do not spend so much money on research and development of new drugs. That is why the price is lower. Okay,
Yes, ma'am.
and can we find any negative side in the use of generics? So against using generics? Do you have any idea?
Ma'am,
Okay, who is this?
yes, ma'am. Samita.
Okay, please.
Ma'am, there's few disadvantages of using generic drug is that sometimes the chemical formulation of the drugs is not exactly same as those high branded value of the drugs. So
Yes,
it might work in the same way, but the chemical formulation can give side effects.
I see. Okay.
Ma'am, generally,
And
when any medicine's patent expires, they create their generic medicines like the dope of that medicine. So we cannot totally trust. And ma'am, it is not potentially being trialed on some organisms or something. So it's not
As
totally
it is
trustable.
directly
So,
treated with the people, many are getting hospitalized now.
and ma'am, like they also have this disadvantage, like if that their appearance may change if the manufacturer supplying, like the pharmacy changes. And ma'am, some people like reported like different symptoms like related to a drug, ma'am, when they
Yes,
switch a
ma'am.
brand name, ma'am.
And Nushat, it is
Like
true that medicines may have a difference, like some pharmacy may have different looking medicine but same chemical formula. So people might get confused that what
exactly.
is this medicine.
Yes.
Mm.
Okay.
So it will
Since
create
it
a
is not 100% approved by the medical thing, the people have lack of confidence, ma'am.
Okay.
They have a fear also in using it, ma'am.
So I
Yes, ma'am.
see. Okay. Thank you. And so if we move here, there is just a diagram that just summarizes some points of comparing brand name drug and generic drugs. So as you see, about active ingredient, there is no difference. About price, you've said that generic drugs are lower in cost, the price is lower. About insurance coverage. So for insurance covered if no generic form exists and normally always covered with the price of generic drugs. Inactive ingredients, you were speaking about this, tested and approved by the FDA organization. This is about the United States. And as for generic drugs, it may differ, but proven to be acceptable by the same organization. And strength or dosage, there is no difference. And in appearance, you've also said about this, drugs are just brand name drugs are standard in size, color, packaging, etc. But packaging and the generic drug itself may look different. That can confuse the patients. Okay, very interesting, and we should remember about this. Well, but anyway, the use of generic drugs is beneficial to the patients. And so now we're going to speak about just patient care and guidelines for prescribing any drug in the hospital. The question is, so why these are important and what might go wrong if you do not follow these guidelines? You can see the guidelines are given here in this box, and let us just read them and discuss the importance of following these drugs. Now, Madhumita, will you read the first one, please?
These are guidelines for prescribing any drug in the hospital. Why these are important and what might go wrong if you do not follow them. Should I
First
continue
one.
on?
The first one, please.
Always consult the BNF when prescribing for children.
Yes, and you see that BNF, this is British National Formulary. So why is it important to follow this guideline?
Ma'am, because they should not mistakenly take wrong medicines, man. They should always consult the doctor or some people who knows about the medicines, and they'll prescribe correctly for the patient.
Mhm. So, and you should also remember about the dosage, yes? So for
They should not overdose it.
mm,
This may give some side effects.
okay, good. Now let's listen to Divya. Are you here?
Yes, ma'am.
Number 2, please.
Consult your seniors when in doubt, ma'am.
Why is it important?
Ma'am, because they are more experienced doctors, ma'am, so we can ask them, ma'am.
Okay, it's important, for example, if a patient is allergic to some drugs and we don't know, we are not sure about this. And we should also always consult the colleague, the senior colleague, okay? What about the next one? Let's listen to Priya.
Yes, ma'am. Check if the patient has allergic reaction to the drugs. Ma'am, it is necessary to check, ma'am, because some drugs may cause side effects or skin rashes. So that first of all, we have to check.
Okay. So the next is for, I'm not sure about Rajkumar. Is he here? Rajkumar. No, Rajkumar. And Badris is also absent. Prerna, please. The next one.
Yes.
Mhm.
Check if the patient is a responsible person.
Yes.
It is required to check whether the person with the patient is responsible or not, because we cannot explain every single procedure that this medicine should be taken at this time and that all to a kid, because he or she might not know that what to do. He might feel that they are some colorful candies and he can take it all at a time. So if any responsible person is there, so doctor can guide them so that they can give appropriately the required medicine of that particular time.
Okay, thank you. Well, then the next is for Nishat.
Yes, ma'am. Check for alternatives to drugs, ma'am. Like maybe other like alternatives may also be there, like eating food ingredients, other like which can help to like cope up with the damage that the person suffering from, like eating some nutrients and some other dishes, or like doing exercises, like which can like alternate the drug.
You mean some not medical, just ways of treating a disease, right?
It can also be medical, less harmful, like than the drug.
Okay. Sometimes
less
so the drugs are very expensive, and you should think about the just generics that are not so pricey, right? Okay.
Yes, generic drug.
Also, ma'am, if
Yes.
after so many these guidelines, sometimes some side effects may also occur. So for that time, a doctor or the patient or the person responsible near the patient should know that what to do next, or he or she should take the correct drugs or
Yes.
to
Ma'am,
take.
Or
sometimes
like maybe
sometimes
alternative
patient may
drugs to
be
that.
Okay. Yes.
sometimes patient may be more compatible to alternative drugs, ma'am.
Yes, you're right. Okay. Okay, so and what other guidelines do you think should be followed before prescribing on or off the ward? Other guidelines. So, Prakriti, What do you think about this? Can you add something else here?
What other guidelines do you think should be followed before the prescribing on afterward?
So, does anyone have any more ideas about the other guidelines? So everything
Yes,
is
ma'am.
yes.
Also
Like,
based on
ma'am, can we stop
can-
some medications like which are harmful?
based on
Okay.
Also, they can read the history, or they can know more about the
age of the
patient
person,
before.
the medicine can be changed, ma'am, or variated.
Also, ma'am, do not stop taking or change of our medications unless we should talk to our doctor or which doctor.
For children,
Okay.
there are light
Medicine.
medicines, and for adults, there are some heavy causing medicines, ma'am. Based on the age,
Patient's age,
the
medical
personal
history,
we can vary.
and any other medications.
I see.
Any other special diagnosed condition, according to that, we have to adjust and prescribe the medicine, ma'am.
Exactly. Yes. Okay. Yes. Samhita.
Yes, ma'am. Actually, there's one point that can be added to this. That is, every whether it's a child or it's an adult, he or she should complete the course of medicine. If doctor has said that these medicine should go for 5 days, then he or she should not stop it in the third or fourth day, considering that okay, I'm well now.
Okay, this is also
Even if you
important
feel good,
point.
continue to take the
Exactly,
medication.
especially
This is the
antibiotics, for
role of the
example.
person. This is the role of the
Yes,
person
ma'am.
responsible near the patient. That is why another person is required.
Okay,
Patient
exactly. Yes.
patient should be prescribed with low cost alternative medicines, ma'am, because many of the patients don't complete their course because the medicines are
They're
expensive.
expensive.
Yes, we should also
Due
remember
to
about
their
this.
expenses, yes, ma'am.
Okay, so thank you. And if we move to the next slide, here we have some abbreviations that common prescription abbreviations, and we should understand the meaning of these abbreviations. As you see, the meanings are given to the right, and let us just think about this. For example, we number 1 PO.
Can I?
Yes.
Like it is taken by the mouth orally, ma'am.
Orally,
Yes,
per os. Os
just
means
this
mouth.
is peros.
See,
Yes. Okay, just
yes, by mouth orally.
let us just have several minutes. Let us say 3 minutes. You look through these abbreviations and you match them with their definitions individually, please. Just 3 minutes for you. So shall we start? Are you ready?
Yes, ma'am.
Okay.
Yes, ma'am.
So we stopped with. Okay, let us listen to Samhita. So can you comment on the meaning of each of this abbreviation?
Ma'am, yes, ma'am. PU means taking by mouth. PRN means PRN means as needed, as required.
So
Then
and okay, yes.
then STAT mean in urgency or immediately. Stat. Then OD means OD. I don't know actually about OD. It
So
can
OD means omni dear.
Once a day, ma'am.
Once a day.
Once a day, ma'am.
ma'am.
Yes,
Once a
this
day.
In
once a
24
day.
hours.
Every
G
4.
medical.
Yes, ma'am.
Okay.
T means gram.
Mm-hmm.
TT means 2 tablets. And OM means in the morning. In the
Yes,
morning.
this is omni mane.
Yes.
This is in the morning.
Yes,
Omni
ma'am.
mane in
Yes,
Latin.
ma'am.
Good. So, and these abbreviations are commonly used in prescriptions. Okay, and this is more complicated. We should say the meaning of these abbreviations used in administrating drugs. You can see the abbreviations which are used to say about the frequency of drugs, then about the route of administration and about measurements. I think measurements is the easiest here. Also, just let us take a couple of minutes and do it individually, and you please make notes just to be sure that we understand everything. So please, a couple of minutes for you to do this. Okay, so we have less than 1 minute, and I think we can just check what you've written after the break. Okay, so let's take a break now, and
Okay, ma'am.
so we'll see each other in 10 minutes.